This episode of Straight Outta Health IT is brought to you by WellLink, your trusted partner connecting healthcare organizations, data, and innovation for a healthier community. WellLink helps healthcare providers navigate complex challenges, from analytics and AI to workforce solutions and community health impact. Because at WellLink, we believe when healthcare is connected, everyone thrives. Learn more at welllinkcommunity.com.
Straight Outta Health IT, the mic stays surgical. Christopher Kunney moves vertical, purposeful. Strategist with the vision, breaking every system's cage. Guests unfiltered, flipping chapters every page. Industry talk raw, no sugar, no varnish. From policies to tech, the convo ain't tarnished. Blueprints unfold, the future in the dialogue. Cutting through the static sharp like a monologue. Change makers in the building.
Hello everyone, I'm Christopher Kunney, and I am your host for Straight Outta Health IT. And I have the pleasure of being here in Cleveland, Ohio at the WellLink CONNECTNEO conference. And today I've got Rahul Mahadevan here. And Rahul is with WITT, which stands for We're in This Together. Rahul, thanks for stopping by and having a conversation with us today. Absolutely. So tell us about WITT. What's WITT all about, and why is WITT here today?
So I started WITT after my own cancer diagnosis 4 years ago.
Okay.
As I went through treatment. I met a lot of patients who were voluntarily missing appointments or delaying treatment.
Exactly.
Because they didn't have the non-clinical support at home.
Sure.
To do the journey. And I realized you can have the best hospitals, the best doctors, the best drugs you want.
That's right.
But if the patient can't get to the hospital to be treated, none of that stuff matters.
Exactly.
And most patients don't like to ask for help.
Mm-hmm.
And so we built a platform to enable patients to ask for the help they need, get the support they need on a non-clinical side, so that they can actually address the life challenges they're facing, so they can actually focus on treatment.
No, that's great. Well, first of all, congratulations on successfully beating your cancer diagnosis and being on the other side, and now being a person who is now advocating for patients as well too. I personally am a brain tumor survivor as well too, so I completely understand the whole patient journey and this issue around trust, right? Yep. You know, when it comes down to that. So talk to us a little bit about what you learned personally, and then through the establishment of WITT, what are some of the core issues and why individuals don't talk about their care, or why they don't trust other individuals, and why is this still a challenge in this modern healthcare system we're in today?
Well, so I think when we think about social determinants of health and non-clinical challenges,
exactly.
I think the fundamental issue is patients don't want to be a burden on anybody else.
Sure.
We don't want to ask our friends and family to help us, not because we don't need it,
right?
But because we as patients don't want to put something else on other people's plate, right? And so we are always hesitant to ask. We're always nervous to share what we need help with.
Sure.
And most of the time, almost all of us have people that want to help us.
Right.
They don't know, but they don't know what we need.
Mm-hmm.
And so if you can actually crack that barrier where you actually make it okay for people to ask for the help they need without the guilt of asking.
Exactly.
And make those needs visible to those that want to help the patient.
Sure.
You can now, I think, bridge that gap between a patient feeling that they can't open up,
right,
and then people who want to help, knowing what they need help with. That is, hopefully, get them the support they need as they go through.
No, that's great. Interesting enough, I just literally finished the manuscript of my book, and the book is called "Diagnosing Distrust: Why Communities of Color Don't Trust the U.S. Healthcare System, and How We Can Use Things like Technology to Close the Gap and Establish that trust." And so, because we do have, unfortunately, historically, challenges in the healthcare system, not always treating marginalized communities equitably as well too. Talk to me a little bit about, are you seeing some of that with the people within the communities that you serve? How are you dealing with some of that still trust that may be historical in nature? Yep. And are there any specific initiatives you got going on to help build trust within those communities?
So we've part of what we've built on our platform, so we white label our flat health system.
Okay.
Right? And we do that because a patient's more likely to trust a platform coming from a Cleveland clinic or from university hospitals than it is coming from me, because they don't know who I am.
Exactly.
And so you leverage the brand of the organization they're being treated at to build trust with the patient.
Right.
But the data you collect in the back end really helps you identify where are the biggest gaps in care for different populations. I can look at our data set and say, African-American males living in Northeast Cleveland may have very different needs than that same population living in Columbus.
Right.
And if you as an organization can tease out those differences, you can actually help health systems put the right resource, the right place, the right time.
Exactly.
To address the specific needs of a specific patient population.
Absolutely.
Not because you're doing a survey, but because the patient's saying, this is what we need help with.
That's right.
and allow them to put the right research in the right place to help.
No, I like that strategy, meeting people where they are, meeting people in those systems where they already have an established trust,
Exactly.
and then leveraging your organization's tools and resources to help, again, continue to foster that trust and get access to your appropriate care pre and post their diagnosis, so that they have a better outcome.
And we're a big believer that it takes a village
Absolutely.
to help a patient. And so if we can shine the light on needs,
Sure.
we've got groups in our different communities where we found restaurants to say, hey, listen, we don't have money to give a patient, but if any patient needs food insecurity,
Absolutely.
here's a voucher for a free meal.
That's great.
Or local church groups saying, if let's get a congregation to identify people in need for in our community.
That's right.
And support them in ways that make a difference. And often it's not big needs.
That's right.
It's $20 for an Uber ride. It's I need help.
Most of the time it is, right?
Exactly. Right?
Yeah.
If you can identify those needs, you can solve that last mile problem.
Absolutely.
So when I went through treatment, I'm sure when you were treatment, our diagnosis was the number one thing we were dealing with.
Absolutely, without a doubt.
So 90% of the people out there, it's the fourth or fifth most important thing. It's how do I take care of my kids? How do I feed my family? How do I take care of my patient? And if we can cross those barriers and allow them to focus on their diagnosis, whatever it may be,
That's right.
I think we can have a big impact on patients.
Absolutely. And not only that, we can give them the ability to take care of their families, pay their bills, meet those obligations that they're worried about because they are not taking care of themselves.
Exactly.
Absolutely. So what brought you here today to the CONNECTNEO event?
So I love what WellLink does.
Right.
I was introduced to Brian about 9 months ago.
Sure.
I met his team, a big believer after I went through my diagnosis.
Exactly.
I want to work with good people.
Yes.
WellLink is made up of good people.
Absolutely.
From Brian all the way down.
Yes.
We're also recently, they're an investor in what we're building.
Oh, that's great.
So we're also a portfolio company of WellLink.
Right.
But being able to leverage their network and their organization to make a difference to more patients. I think WellLink as an organization is really focused around community health.
Right.
People making a difference to the communities and the people that are in the communities, which ties very closely to why I started the company.
Exactly.
And so I'm just honored and blessed to be part of the WellLink family, be part of CONNECTNEO, and meet with incredible people around the organization that are all driven for the same thing. How do we make a difference for those that don't have what we have?
That's right. And like you, I've been involved with WellLink for some time as well, too. Actually, they're a sponsor of the podcast as well, too. And I've known Brian for a while, and he does have a village mentality. He this organization. It takes a village to solve these complex problems, and rising tides raise all ships as well.
Exactly.
You have to look at the entire community and not just our own individual situations in order to improve outcomes for everyone as well.
And this whole team, I think, embodies that message. Absolutely. Like every single person I've met has been like, it's all about let's do right by everybody else. So I'm just honored and blessed to find an organization where I can take my journey and marry it with their journey. And how do we together make 1 + 1 = 11?
Absolutely. Well, I applaud you for your efforts and to not only improving lives of your life, but in thinking lives of people in your communities as well. I wish you continued success. Well, thank you so much, Dr. Barr. It's a pleasure meeting you. I wish you continued success and continue good health as well.
Thank you. Appreciate
Take care.
that. All right.
Have a good time, buddy.
All right.
Absolutely. All right, welcome back. And I am with the gentleman that actually put all of this together, Brian Lane. He is the president and CEO of WellLink and the Healthcare Council. WellLink is a big sponsor of Straight Outta Health IT, and I am so thankful for their sponsorship and their support. And I'm thankful that they've allowed me to come and be a part of CONNECTNEO as well, too. It's been an amazing session. So, Brian, thank you for your partnership.
Chris, thank you for our partnership, for our partnership.
Well, absolutely.
And I want you to know, on a personal side, not only do I admire you, but I'm serious. This opportunity of us doing things together and making change and providing uplift education is so important.
Well, thank you.
So that's the reason why we're both here.
Yes.
And we're both here to share with everybody a lot of news regarding WellLink. And what we should also tell your viewers is how they can be participants with us.
Absolutely.
Right?
Well, let's do that, man. Let's jump right into it.
All right.
A lot of good stuff. You made some amazing announcements earlier this morning about what's happening with WellLink. So why don't you share with our listeners?
I shall.
What's going on?
All right. So first off, everybody, thank you for listening to Chris and Straight Outta Health IT. As I said, we're very appreciative of this partnership. The association has been around actually since 1914.
Wow.
Right?
Wow.
So only a couple of weeks.
Yes.
And I was supposed to make a few of you laugh. The association has always been geared towards the community, providing connection. And so what we've done is literally look at the bylaws, look at the association, and retailor it to go back literally 100 years ago.
Yes.
And recast it for the future.
Absolutely. Now, 100 years ago, it wasn't called WellLink, right?
No, it was not. It was actually the Greater Cleveland Hospital and Healthcare Association.
Yeah.
And so it encompassed churches, synagogues, government leaders. The hospitals were just in formation at that time locally here.
That's right.
Yeah. So in Cleveland, we've now grown to over 37 plus facilities. And so what Chris is also alluding to and kind of giving you guys some awareness of, WellLink has just grown. We have merged with the Healthcare Council, which is a leading healthcare association created in and around the 1946 period of time.
Right.
And that was representing literally 10 different states.
Wow.
Yeah. And so now that is part of our organization.
Yes.
And we are
by exponential growth.
It's incredible growth.
Yes,
I think it's 17.5x.
Wow.
Yeah. And we're still growing because we just changed the whole membership game.
Okay.
As well. Most hospital associations operate off of members' dues. We're lucky because we have a lot of for-profits inside of our organization.
Exactly.
And so we are able to yield revenue that can actually lead to results.
Sure.
And one of those things is our group purchasing organizations, other are just core investments.
Yeah.
And, just growing strong.
Right.
So
that's great. That's great.
Yeah.
So for those of our listeners who have been living under a rock, they don't know anything about WellLink and the services you offer, why don't you kind of outline at a high level what does WellLink do?
Yeah. So WellLink provides its members the ability to have government relations and advocacy.
Right.
It also allows the members to network with one another, get CEs. And the unique thing with us right now, which is what Chris is really kind of is having me zone in on, is we changed up the model. And so since we moved from this typical dues model where most of the hospitals and healthcare institutions would pay upfront for their members' dues, we took the dues model and turned it on in. And so we basically have allowed for all providers to have one voice within North America, that is FQs or FQHCs,
Exactly.
Community business organizations and benefit organizations, I should say, the YMCA, food banks, churches, synagogues, to have a membership position.
Inclusiveness of it too, because I've been involved with a number of different things. That's why my point was going to be as well too, and that is they bring in that broader community of health players to be under one umbrella of membership and partner with each other. And that was the thing I was really interested in and excited about in the first session that you moderated earlier this morning, was the whole talk about collaboration and the whole talk about partnership and finding ways to work together and not and leverage each other's strengths versus competing against each other. I think that's a whole new paradigm shift in healthcare.
Myself and one of my core mentors, who you know very, very well, we both came out of the association world, and each one of us would look at it a little bit sideways because one, like, what is this totality of value proposition? Right. How are we going to be recognized? How are we going to create an immersion or an aggregation of everybody's needs in order to create a sustainable community?
That's right.
Not so much just four walls or a hospital, but the community.
Exactly. And how do we work together to combat the economic forces and political forces?
Oh, you're winding me up.
Oh, no, I'm right there. buy or sell. So, I mean, it's
You
gonna
can't.
take, you can't.
You cannot.
Yeah, it's gonna
You
take
cannot.
advantage. Yeah.
And so I have a phrase,
Yeah.
and it's a goofy equation, and I am actually decent at math,
Yeah.
even though this is not going to seem like it.
All right.
It's 1 + 1 = 6.
I love it.
And so if we gather together and we connect, just like we do,
Yes.
then it's a greater sum for good, and it's uplifting.
It is.
And that's how we have to look at things, which
Exactly.
is, guess what? We might not all have the answer.
Right.
We might not be the subject matter expert.
Right.
So we reach out and we grab new people within this membership.
Absolutely.
And we want all of you to become members. And you have the opportunity of becoming a member
Yes.
of a hospital and healthcare association that normally most people would never get that opportunity.
Exactly.
So please be a part of it. And I think you'll be surprised the things that you normally have seen in the marketplace. This is much different.
Absolutely. And I can tell you, even from an entrepreneur's perspective, a business owner perspective, who is now plugged into WellLink and its ecosystem as a sponsor. Again, I'm a small business as well, too. It's a great ecosystem to be a part of. Brian and his team are so welcoming and supportive of my company and what I'm doing. And the investment cost to be a part of this is far nominal compared to other organizations that I've been approached by or I've investigated. This by far is the best value without question. So I appreciate it. I am back with Jason Ferri. Jason is with Premier. Jason, thanks for stopping by and thanks for having a conversation with me. Tell us a little bit about Premier. I know who you are, but for those who don't, if you haven't been on this planet for much longer, Premier is an amazing organization that's tied into healthcare, but I'm not going to steal your thunder. You tell us a little bit about Premier.
Well, Chris, thank you for that. So Premier is a group purchasing organization at its most. We have about 4,200 plus members, health systems that are part of our membership, plus over 350,000 plus non-acute. And why kind of we're here and why we're healthy, we work very closely with the WellLinks of the world, where we provide a national portfolio of contracts that we pre-negotiate to really help benefit the hospitals. Right? When you think of a group purchasing organization, you're like, well, why would you do that? The idea behind it is that one health system trying to garnish price pulling value, you not necessarily do it on their own. So if you have a collective membership, suppliers are willing more to kind of offer pricing and value.
Absolutely.
And then we can, in return, offer that back to the membership. And then our close partnership with WellLink is that WellLink kind of addresses the acute and non-acute, smaller type of areas. So they're able to benefit from what we negotiated plus what they negotiated in order to offer value and services back to their membership. So together, we work with a strong partnership. I've been with Premier for 12 plus years. I remember when WellLink was Chance after then became Premier. So it's been, I've known Maria for a long time. I've known Brian for a long time. So it's great to get a chance to work with them and be here to get an opportunity to, see the providers that they actually serve.
Right.
Which was great.
You're here to support WellLink and its members, but I'm curious, as you look across the broader landscape of healthcare, since you got so many providers that we're plugged into, what are some of the consistent themes you're hearing from the provider community in terms of the challenges or initiatives that they're focused on that you guys can help solve problems?
Absolutely. One of the biggest things we keep coming across right now, I hate to bring up tariffs, but they're always there.
Right.
So pricing becomes the challenge. And where we try to help them navigate is understanding that the pricing impacts that are out there are different in the financial sector versus the healthcare sector.
Right.
In the healthcare sector, they're much more dramatic, much more impactful.
Yes.
So what our role in that one example, and even when it comes to shortages, think of the oil prices going up, how that the downstream effects. So we work very closely with our suppliers to try to help mitigate those pricing increases, to try to help in the shortages aspect of it. Because again, when you have large price increases like that, there become shortages in the industry.
Absolutely.
So we're out there helping our membership understand what other options are out there. How can we help mitigate those price increases? And how can we make sure that you get the product? Because ultimately, they're there to provide care.
That's right.
Not worry about how do I get product.
Absolutely.
Let folks like myself and WellLink worry about getting product. You worry about getting patient care.
Let's drill down into that a little bit further, too, because I was interviewing someone earlier and I was asking her, she's on the supply chain side as well, too. And I was asking her what are the challenges is actually supply.
Supply disruption.
Play like gloves. Gloves being one of the challenges they have right now. But talk to us a little bit about, what you're seeing in the market as it relates to these supply chain issues. And then how is Premier helping to mitigate some of that risk?
One of the things that are, since we're not in the IT sector, I'll bring it up. So right now there's a huge situation with, just talking to one of the suppliers, with IT chips,
Right.
okay, more with microchips. Significant price increases because of the expansion of AI and data farms.
That's right.
Now are taking up our chips.
Absolutely.
So what happens is our suppliers are expecting a price point that we've helped negotiate with our suppliers, but that's no longer becoming valid because the OEMs, in the end, are stuck with this shortage in which their pricing fluctuates sometimes daily.
That's right.
So our role in that is, one, can we help mitigate the price increases by the relationship we have with the supplier? Right. And the second part of that is, can we educate them on how to better purchase? For example, I just was talking to a provider. In this specific example, it's IT. The quote to PO is 5 days or less. So don't be looking for quotes if you can't purchase within 5 days. That's one scenario.
Right.
The other scenario would be, even though it's not easy to do, is it possible to purchase ahead?
Right.
So that you can lock in that price point, because it's only going to continue to rise.
That's correct.
The other aspect of how we help is that keeping our suppliers honest, that when the pricing could go down or should go down, do you bring your price point down?
Right.
So we kind of mind the shop on top of that, because price increases are unfortunate, and we do our best to hold our suppliers accountable.
Absolutely.
Some
of the economic conditions.
You have to go for it, but our role in that is to, one, make sure that it is short term. So we may have 30 days or so that we check back with those suppliers, and a lot of them based on certain indexes that determine the pricing. Okay, has the index changed? If so, time to adjust the price. So we never allow price increases to be permanently or indefinite.
That's right.
So that's kind of where we really help, and where WellLink and ourselves come into play. If a small hospital is trying to do that on their own, therein lies the problem.
That's right.
Let us use our voice to kind of really help them.
It makes perfect sense. We've been talking about AI and its impact on healthcare, but I'm curious AI's impact on supply chain. Yeah. Talk to us a little bit about.
There's a lot of solutions that are coming out. Premier has one also where it's becoming predictive on potential shortages, going back to your situation where supply chain. So we're seeing AI, even within Premier. We made a large investment with a company to help really provide AI analytic data back to our members, so we can show them where the savings opportunities are. Historically, in the past, you go through spreadsheets and all the information, right? So with the relationship we have in the space, we're going to be coming out with tools that would allow the membership to see, where can I move to a tier? What type of volume I need to have to get that price point? Where am I not activated where I could be getting that price point? So all that intelligence that today is kind of hit or miss, we're using AI in that space for that. And I'm seeing that in supply chain too, right? Again, there's a lot of AI tools.
Yes, there is.
No matter what, there's still going to be the human element to that. But at least it gets you 90% there. So maybe only 10% you're looking at it versus looking at it the full 90%. So that's why I see AI making an impact. I certainly don't feel like it's going to erase roles or jobs, but it's going to give the opportunity to say, okay, got me that much further, that much faster.
Right.
Still got to look at it, but I have a head start. Where before I didn't have a head start.
Yeah, that makes perfect sense. So, as we wrap up this segment as well too, here's the opportunity for the little elevator pitch, right? Yeah. And that is, why Premier? Why should a health system that's trying to figure out who they should partner with when it comes to a group purchasing organization? Why Premier?
Sure. So we serve multiple markets, right? The large IDNs and the community hospital. Sure. So from a large IDN perspective, we're bringing a wealth of knowledge and data to help you mine what you're trying to do. A lot of times our data is utilized, our claims data and all that, to help them determine, hey, what's the best outcomes can I get? Exactly. What type of data can I use to make better informed decisions? What kind of outcomes can I improve?
Right.
For the small hospitals, just even on the GPO side, we're helping them get pricing and service that they couldn't really get on their own. They're trying to really help serve them. So if you're kind of in that position, like, I'm a huge IDN, do I really need somewhere like Premier? The answer is yes, because we're still able to assist in what you're trying to do beyond just pricing. Pricing is always the bottom line, but all the other services we provide on top of that, whether it's advisory, whether it's our tech tools, whether it's our population health solutions, all those things kind of help you guide your outcomes for better scores and things in that area. And then again, on the smaller hospital side, which we serve a lot of them, there's quite a few community hospitals out there. It gives them a bigger voice than perhaps they had.
Exactly.
And then we can help drive that.
That's great. That's great. Pleasure meeting you.
MWA. We're keeping it going. See the real here.
Absolutely. Thank you so much for hopping on, and enjoy the rest of the conference. All right, I'm back, and I am with Dear Amighi.
Nice to meet you.
Pleasure to meet you. He's with HealthCorum. First of all, let's take a step back. Introduce yourself.
I'm Amighi, President and CEO of HealthCorum. Been in the industry for over 3 decades.
Yes.
Started my earlier stage as part of the Bayer, and at that time, ACRA was one of the divisions of it.
Well, you've seen quite a bit of transformation that has happened over the past couple of decades.
Absolutely.
In healthcare. What's exciting you right now as it relates to technology and the digitization of healthcare?
So this is a part of my passion as well, right? So that because of that, we started a company about 6 years ago. Called HealthCorum. It's a data analytics company that is looking at wasteful spending within healthcare. So there's over 1/3 of the spending in healthcare is waste.
Right.
Not only that's
And what is that? I was going to say, where is that waste?
So it's coming from the different factors, but it's coming from the fact of it could be that is deliberate, or it could be that is non-deliberate, which much of it is non-deliberate, because providers are, when they come out of the school, they continue practicing the same way that they practice. Our CMO will say, when he gets out of school, you stop almost learning, right? And you practice the way that you know it. Right. Unless you can be shown a different way.
Okay.
And as we know, most providers are very competitive. That's why they are.
Exactly. That's what it is.
Exactly. And it's showing them and giving them enough information that how they can do better is really what makes a difference.
Sure.
And that's what at HealthCorum, we score 1.5 million providers nationwide on their overall quality.
Exactly.
And it's not about if a person has a good bedside manner or not, but rather based on claims data. So objectively, are they doing high value care?
Sure.
So with that information, organizations are able to build networks. They are able to help their providers get better. In hospital areas, it's more built around understanding the leakage, understanding the market intelligence of how the market is doing around them.
Exactly.
Who are the right providers to bring in, maybe to the network that they do not have, as well as, for example, CMS team is one of the areas that we can really effectively show where you can go with being able to actually leverage that and make money with it.
Right.
Going blindly into it and 2 years later and not know if you're going to lose money or win money.
No, makes perfect sense. So who do you typically interact with within that healthcare ecosystem? Is it the CMO, the CFO, the CEO? Very good. And a little bit of all of them with the
Well, so our solution, our data really fits an enterprise level.
Okay.
So it can be utilized from a simple thing as in the provider lookup capability.
Sure.
All web applications and everything now have that.
That's right.
But rather than choosing A to Z or by distance and not knowing if that's the right provider for what you're going to do, for purpose that you're choosing, or having a list of 50 to go through, pick one and hoping that you get the right one, essentially. The organizations are using our data to surface high-value care providers to the
Exactly.
Because to be honest, nobody's going to go to page 35 to pick a provider.
No, they're not.
Right? So essentially is the idea of having the right provider.
Absolutely.
In your session, that was one of the things that came up is how do I surface the right provider at the right time?
Exactly.
Right? So that's what we bring to the table. From that simple thing to ability to build a network, knowing who are the right providers to bring in into your team, or how to actually improve the outcome of the current ones. And it also is used for contract negotiations and other factors.
Exactly. Are providers receptive of this type of analysis that's basically rating them in terms of
very good question.
ability of care?
It's a very good question. First of all, the rating is something that now is the country and the world is used to, right? So we have not had any pushback of somebody saying that no, the rating is wrong or anything else. But it could well be that we're not saying 100%.
Right. So there's always one out there.
It's all about the data and how the data is showing us, and not all data is 100% of
That's
data,
correct.
right? So that point. But overall, what is important to a provider is if they are being measured, they want to know that they are being measured based on something that is actually transparent.
That's right. Quantifiable.
That's what we bring to the table, is a transparency that helps us avoid the fact of, hey, my patients are sicker.
Sure.
Or,
Right.
no, this is not right. How do you come up with this number?
Right.
Understanding the metrics that went into a score, understanding of is this provider actually dealing with a sicker population or not, to be able to adjust based on the severity of the population.
Right.
Who are they being compared to? Are they is a peer-to-peer, or are we comparing a hip surgeon to an elbow surgeon?
Right. So completely two different things.
Exactly. Like for example, in orthopedic, the level of the data that we have, we actually go up to 10 different subspecialties.
Yes. Oh, wow.
So, and which is nobody else that we know in the market is doing really in that respect.
Exactly.
To be able to identify a surgeon that is doing a elbow surgery or the one that's doing a knee surgery versus the one that's doing knee and hip surgery.
Makes sense. So what brings you to connect this week?
I love the fact that this is a thriving environment, to be honest.
Sure.
WellLink is really the reason that we have been very excited about what can happen in healthcare, to be honest with you, right?
Yes.
So as an organization, we have always been in the background. Our solution is used in a number of applications and through channel partners.
Okay.
Right? But through WellLink, we have now ability to actually present that to hospitals and systems that can utilize this in a way that helps them understand the market, giving them the right analytics at the right time to be able to make the right players.
Makes sense. So WellLink is acting almost like a channel partner for you in many ways in terms of
they are the champions for not only us but the whole health, all the members that they have. Right. So it's a matter of, I think the conversation was, can we put the right people together?
That's right.
To do something right.
Exactly.
That's what excites me. The whole idea is, and that's where I said our passion really is to reduce wasteful spending.
Sure.
Right. So we came together as a company. My team has been doing this type of work for over 20 years.
Exactly.
We came together 6 years ago with one thing in mind. What can we do different than anybody else in the marketplace to help reduce the wasteful spending in this country?
Makes sense.
Costs are going up.
Yes, they are.
So absolutely.
That's right.
One of the areas, for example, that we are doing is by being able to get the member, patient, consumer to the right provider, you're actually reducing the pressure on the whole system.
That's correct.
One of the things we talked about earlier is the fact that there's not enough labor.
That's right.
In the marketplace.
And it's getting worse.
It's getting worse. But part of it is also the labor that is there is utilized incorrectly. Part of what they do, then they should not do. Part of people that they see, they should not see. So if we can really reduce that extra burden that they have by getting the people to the right people.
That's right.
At the right time.
That's right.
At the first time.
There you go.
Is you're reducing that whole pressure for the nurses, for those people that are booking the people, everything else that goes down the path.
Yeah. It makes perfect sense. Well, thank you so much. Enjoy the rest of the conference.
Thank you very much.
Absolutely. Well, we're back, and I have on this episode one of my colleagues. He actually just finished our panel discussion, John Paganini, and he is with the PAGWA?
It's called PAGWA. In fact, PAGWA AI healthcare consulting firm.
There you go. I'm not going to repeat that. You said it. And we just finished our AI governance session.
Yes.
Standing room only, and had a great conversation.
That was a great conversation.
Yeah, great conversation.
Excited so much.
Yes.
And at the same time, there was a lot we didn't cover.
That's right. It's absolutely. So we're going to bring him on to my podcast, and we're going to take the time to explore those other topics we didn't cover. But while we're here, I did want to grab him real quick. And he has an interesting initiative that you're working on right now that we wanted to talk about as well. So I'm going to turn it over to you,
Chris,
John.
thanks. It's under the umbrella of Northern Ohio HIMSS, Healthcare Information Management Systems Society. 2 years ago, we formed an organization called the AI Center of Excellence here in Northern Ohio, specifically focused on healthcare. And it was at a conference just like this where there was 3 major hospitals all showing and demonstrating and talking about their innovation in cancer in AI and the use of it. And everybody was doing phenomenal things separately, in a kind of a silo.
Absolutely.
On the message that we heard this morning here at this conference, it was all about collaboration and partnership. So at the end of that panel, I stood up and I boldly said, we should form an AI center of excellence here in Northern Ohio, and the entire audience clapped. And of course, the board said, good idea.
Right, you did make it happen.
Go do it.
That's right.
So 2 years later, we have 150 members.
Wow.
A lot of hospitals.
That's
Grand
great.
Northern Ohio. We've got some major vendors too,
Sure.
but international. Got some law firms. We've got some colleges and universities.
Exactly.
So it is really an interesting mix. We're focused on advocacy,
Yes.
health AI literacy, very important, which we didn't get to talk about too much today.
That's right.
And also data management. We're hoping to create a sandbox for us to test our innovation in.
Exactly.
And now, of course, governance and framework. So those are the 4 committees we've started so far.
Right.
A lot of energy and a lot of enthusiasm from the members.
Yeah. Well, first of all, I applaud you for taking the leadership on this and forming something that's really going to be transformational for this region, and set that as a precedent for the rest of us who are part of
There is some products where we maybe take it up to a national level.
Absolutely.
Yeah.
Absolutely.
And of course, on the panel with as a co-chair of this is Jennifer Owens, who also participated today.
That's right.
From the Cleveland Clinic. But one thing the in partnership with WellLink, the host of today's conference, we put together a grant proposal for a digital equity initiative here in Cleveland. And a couple of weeks ago, the proposal was awarded, and we have a digital equity grant right now.
Congratulations.
And our AI literacy team is developing the curriculum, and we are going to be teaching the underserved of the Cleveland metropolitan area about how to use and access their information in healthcare.
Exactly.
With an eye towards using AI in that, and the cautions that come with using AI to manage your own healthcare.
No, I again applaud you for that. I mean, talk about a game-changing initiative to reach into those underserved communities and bring that exposure of AI and the possibility of it, and start to really spark the interest with the youth to consider moving towards careers in this space.
Absolutely.
As well too.
Yes, I'm a big believer in we should be learning AI in schools.
Absolutely. Absolutely.
Because we all know that when you graduate from school, one of the things that's going to be absolutely necessary on your resume is, do you know AI?
That's correct.
Yeah.
That's right.
And as we talked about today, knowing AI is a start. I mean, the mechanics of it.
That's right.
But how do you manage the AI to make sure that you're getting the right information out of it?
Absolutely.
It's a different skill.
The whole
set.
prompting, component of it as well too, it's key. And that's where, to your point, the whole literacy piece is so key, not only just in this underserved communities, but quite honestly, within the health systems themselves.
Yes.
And to your point, we didn't get a chance to explore this conversation in detail in our session, but I usually ask that question. And that's, where is your organization's level of literacy when it comes to the adoption of AI? Yeah. Does the person at the receptionist, the registration desk understand AI? Does the person, who is in the cafeteria understand how to use AI? It's not just AI for the executives and for the clinicians. It's throughout the entire organization.
It has to be a strategic organizational initiative.
Absolutely.
That has to come from the top down.
That's right.
I mean, right now, people are bringing, AI into the workplace.
That's right.
And it's starting from the bottom up in some ways.
Exactly.
That is a little bit Wild West in some ways, right?
Right.
No control.
Well, these are the trees that are being brought in, whether it's at the analytics level or down to, again, the operational levels. Within the cafeteria, within the maintenance group, they all have AI built into them now.
Yes.
Right? And so how are your people understanding and leveraging?
Sure. But when you think about it, and I do AI training, one of the first things is, how we're using AI already in Greek Life, on the phone and Netflix, Alexa, all of those things. It's already here. It's been here.
That's right.
It's embedded deeply. And now it's being extended into the workplace as a tool that we're all using.
Absolutely.
So there's a journey in a sense. You get from AI literacy, then you move to mastery, and then you have fluency.
That's right.
Where you're really competent in the AI journey that you're on.
Well, I again applaud you for your leadership in this space and the work that you got to be doing, focused on those communities that will gauge the understanding.
I think at the beginning of how the Center of Excellence is going to get back to the
Absolutely. And as a current Georgia HEMS board member, soon to roll actually off the board, if there's anything I can do to support you in this effort,
likewise,
don't hesitate to reach out.
Maybe there's
love to do that.
Collaborative faster
Absolutely.
focus. Really
Well,
key up on that.
I've got some ideas that we'll talk about offline as well too. Well, we're back, and I have Dominic Hobson, who is the CEO of Neighborhood Family Practice. Here, he just finished a panel discussion where he provided some amazing insights on the challenges and opportunities and need for collaboration with the community as a whole and healthcare. And I wanted to have him come on and share a little bit of his thoughts and insights with our listeners as well too. So Dominic, thanks for stopping by, and appreciate your commentary earlier today. Tell us a little bit about you, your role, your origin story, and what brought you here today.
Thank you. First, I lead Neighborhood Family Practice, which is a Cleveland-based heavily qualified health center. And you heard me talk earlier. We believe that the way that the future for our community is building a world-class front door to our health.
Exactly.
And so we have amazing care in Cleveland, especially amazing hospital care, amazing self-specialty care.
Yeah.
But we need amazing primary end of care.
Absolutely.
As our communities that have the worst outcomes, that is what they need most of.
That's right.
And right now, they don't feel like they have true access to care. And that's what we're trying to solve for as an organization. And so what I've been able to do is leverage the expertise of providing care in a massive health system like the VA and translate that into the work that we do in a small community-based setting.
Absolutely.
The key emphasis on partnering and leveraging our larger systems to benefit our patients and our community members. The last thing that I'll say, in our work, of course, from a community health center perspective, our expertise started off in providing care that you can navigate in poverty.
Sure.
That's the work that he did best. And for me, that's personal because I grew up in southern Mississippi, raised by a single mother.
Right.
And we experienced a number of challenges from a financial standpoint. And so when I think about our patients that we're serving and the work that we're doing, I want to make sure that we're creating a system that shows them that they're valued when they walk through our
Absolutely.
And I want to make sure that they feel supported, that they're getting the care they need from us.
You know, I just had the opportunity to finish my manuscript for my first book. It's called Diagnosing Distrust: Why Communities of Color Don't Trust the U.S. Healthcare System, and how we can leverage technology as its cure. I'm curious from your perspective, you guys talked a little bit about it earlier around trust, but we talked about it more around trust as it related between health systems. I'm curious from your perspective, having grown up in Mississippi and grown up, potentially in marginalized communities, the impact that having a system that people in those communities trust, given some of the historical challenges we've had with our U.S. healthcare system with those communities, the importance of the FQHC, the importance of the FQHC building trust in the communities, and what are maybe some of the challenges you so experience in that space?
I think that's one of the things that really, that why we stand out.
Right.
Cover that trust that we have with our employees and with our patients. And honestly, that's the main reason that typically larger systems or local or federal government agencies call on us is when things have gone wrong. Think about the pandemic.
That's right.
And so we were at the forefront of that response because our community members, our patients trust us. We're in the neighborhood. They see us every day, day in and day out, doing the work and supporting them. And so that has allowed us to really build up that trust that we then leverage to encourage them to pursue the things that they need to from a healthcare perspective.
Sure.
But as a system, I think we have to start by acknowledging that the reason that distrust is there is a real and an accurate and legitimate reason.
That's right.
Our system has done a lot of harm over the years to marginalized communities, especially our Black and brown communities.
Absolutely.
So I think if you start there and understand that some of our community members are bringing that with them.
That's right.
And it's been passed down over years and generations, right, into a place where whether it be the response when there's an emergency from an EMS standpoint.
That's right.
Or what happens when we show up to the hospital.
That's right.
Or even the trust that we have in our transplant system.
Sure.
And so there's
vaccination system.
There's so many factors to it.
That's right.
But we have to make sure that when people walk through our doors, we acknowledge that is real.
Absolutely.
Listen to what is the history behind that for that person.
That's correct.
If you do that on an individual level, then you have a better chance of hopefully breaking down that barrier.
That's right.
Getting them to accept or have more
earn that trust.
Yeah.
Right.
And then they're more inclined to receive that referral or to do that vaccine or do that follow-up if you meet them where they are.
Absolutely.
Truly understand and acknowledge that your mistrust is real.
That's right.
And you have a reason for that, and how can we help solve for that?
That's great. That's great. You know, one of the things I really appreciate that WellLink is doing is its understanding and appreciation of those challenges as well, and its focus on things like social determinants of health, and the work that it's doing in this space as well too. You haven't, I don't think, how long have you been in the role again?
4 years.
4 years, okay. So you've had a chance to work real closely with WellLink. Give us your perspective on the impact that WellLink has had on your organization and helping to support the challenges in the community.
I think the bigger impact will be in the future.
Okay.
And what I mean by that is I appreciate that they're working to bring all the different healthcare entity types to the table.
Sure.
And so we all have our own trade associations.
Exactly.
Association for community health centers, our hospital associations.
Right.
And honestly, there's more in common that we have that are different.
Right.
But when we go to talk to our stakeholders, our legislators, we're talking about our specific group and how does it benefit us.
Right.
And there are some times where we're not aligned in that.
Sure.
But there are opportunities that we can come together to say these are the problems that will help solve for what we're seeing locally in Northeast Ohio. And it impacts all of us.
That's right.
And so imagine the power of that. So I appreciate that the WellLink team is working to build a system, a model that brings all different types together.
That's right.
Behavioral health, our primary care associations and primary care providers, our hospital systems.
Right.
And then now we can find those things that we're aligned on, and then we lean into that.
Absolutely. No, that's great. Rising tides raise all ships, right?
Sure.
As we wrap this up, help us understand what are the 2 or 3 real key initiatives you're focused on right now, and how is this event helping you to start thinking differently about how you address those issues?
I think the biggest one that we focus on is sustainability.
Right.
We're serving 23,000 patients, and if we're not here, we weren't here. There's nobody that can immediately step in to meet that need.
Right.
And so for us, we have to make sure that whatever we do, we're sustainable as an organization.
Exactly.
And for us, the second thing is then how do we achieve that? How do we continue to pursue that? It's through scale in a sustainable, in a strategic way.
Right.
And so how do we make sure that we are leaning into what we do best, getting closer to those patients who have difficulty navigating our system, like they have access to our system, and make sure that we are putting resources in closer proximity to those individuals.
Sure.
The last point, it always comes back to outcomes. And so for us, we are heavily invested into value-based care and population health.
Right.
And so for us, we benefit everyone whenever we bring their costs down, whenever we can manage chronic conditions, whenever we can get our appropriate cancer screenings on a timely basis. And so those are the 3 things that we're focusing on. And I would say at a conference like this or a session like this, you have people who are doing those things well. And I'm a true believer in not reinventing the wheel.
That's right.
How can I leverage from our partners? How can I leverage, the work that our health systems are doing? How can I work closely with our other social service partners to make sure that our patients are getting the referral that they need from a social determinants of health or a social needs perspective? And so those are the things that we're focusing on. And
first of all, thank you so much for your service and the commitment you have to the Cleveland community and to this issue broadly. So Cleveland is a microcosm of what's happening across the country. Your leadership is helping to transform healthcare. Thank you for your time. And if there's anything we can do to support you, don't hesitate to reach out.
Thank you for having me.
Absolutely. It's a pleasure being here.
Straight Outta Health IT, where the talk stay free. Tune in, turn up. This is where you want to be. Data-driven dreams, they decode the code. Hack the status quo, make the old ways implode. Gusts dropping gems like pockets of gold mines. Healthcare's front lines, redesigned in real time. Kunney got the mic, architect of the chatter. Revolutions in the air, healthcare's new chapter. From telehealth to equity, nothing stays unseen. This is more than a podcast, it's the dream machine. The system's pulse is beating to the sound. Voices of change.